Okay, Bola will start recording it. Well, she has started recording it already. So just as a reminder, the content of this webinar is aimed at GPs mainly in Barking and Dagenham, but there will be other webinars that will involve other areas. So a lot of
internet audio, dial in or cancel. What is it?
Dial. Internet.
Sorry, can everybody go on mute, please? Thank you.
So you have to go on mute.
Mute, please. Thank you. So a lot of work has gone on in this area to provide a consistent approach across the whole of North East London. And we do recognize that there's a need to provide a local focus that best meets our own local communities. So this is part of that process. We will be undertaking several similar webinars and communications with GPs in other areas of North East London. So we have the question and answer chat. Please feel free to add any questions or comments there. And as we go along, so wherever possible, we will try and answer them. And at the end, you'll be able to ask our speakers, which is Dr. Dustin Saint, Dr. Anju Gupta, Dr. Shabana Ali, and myself, any questions that you have. If we can't answer any questions tonight, we will make a list of them and then get back to you in the next week or so. In addition to us GPs and other leads, we have Louise Brent and we have Richard Clements, our senior commissioning leaders from the CCG. We also have Mark Lockwood, who has commissioned Accurix for us and other projects. So they will be around. So if you've got any questions, you can in the question and answers at the end. Okay, can I have the next slide, please? I'm just going to share with you guys the agenda for today so you know what's happening. Can I please request everybody to go on mute, please? I can still see a few people, so I'm getting feedback. Thank you. Yes, so I will hand over to Dr. Dustin Saint, who is a GP, and he's leading on the One Contact. He will talk us through that product. And then Dr. Shabana Ali, then Dr. Anju Gupta, and then I'll take the question and answers at the end. Thank you. Next slide, please. So by the end of this webinar, you will know what the benefits of remote monitoring are for our patients and surgeries, what digital platforms are available to us, what has been commissioned. We will be able to, access One Contact and know how to do that, how to start using it. And we'll also share what tools are available to remotely monitor patients. And how does this apply to oximetry at home, blood pressure at home, and other monitoring that is associated with other long-term conditions? And I think the most important thing, when tools are given to us, there is some kind of feedback or reporting we need to do back to the commissioners. And we'll share with you how to make it as easy as possible. Next slide, please. So, Hi, thank you. Just a reminder about the mute button, please. Can everybody go on mute? Can everybody check if they're on mute, please? So can I have the next slide, please? The long-term plan. As you know, the long-term plan recognizes that personalized care for patients is central to the new service delivery for the NHS. And this includes working through the PCNs that we've developed, and people have more options, they have better support. We want it to be properly joined up and in the right optimal care setting. So we want to support self-management. We want patients to know how to manage their own health at the place wherever they feel best they can do that. So by teaming together remote monitoring with education and support in knowing how to manage their conditions and when to seek further clinical support, patients will have greater confidence and control and be able to avoid unnecessary face-to-face appointments with clinicians. Next slide, please. So the NHS at Home program will bring together a number of different initiatives to provide better connected and more personalized care for people in their own homes, including care homes supported by technology where appropriate. So this work will be supported by the NHS to move a fundamentally different model of care that makes the most of the significant shift towards remote monitoring and home-based care. That we had to do in the COVID-19 pandemic. So in line with the phase 3 guidance, NHS at Home will support the inclusive restoration of NHS services through ensuring that digitally enabled and remote monitoring pathways remain focused on individuals. So it's going to be informed by individual personalized care and support plans wherever possible. Next slide, please.
What do you think?
I just want to remind again, can all of us just check our phones or iPads that we're on mute, please? Because I think there's someone still, there's a couple of people still not muted. So we're getting a lot of feedback. Thank you. So the benefits of remote monitoring is that patients will get used to monitoring their health, weight, blood pressure, oxygen saturation. It will empower them to look after their health. Patients don't have to spend time traveling between home and healthcare settings. Work and other life commitments, that become a barrier, will overcome them. It will increase access to healthcare, reduce the inequalities. It's protecting clinically extremely vulnerable patients who may be shielding. And this also goes the other way around for staff who might be shielding. So it will help us keep all of us safe. And it will also provide safe monitoring of patients who struggle with change in care settings, such as, we often notice that patients with learning disabilities or serious mental health, they often get very restless when they come to our waiting rooms and have to wait there outside if we're running late, or patients who are in nursing homes. Next slide, please. So, as you can see, this is kind of going over the same things that I mentioned in the other slide. So the benefits of remote monitoring for primary care teams is that you can have a more focused conversation with patients, especially the ones that choose to use digital platforms. So I know that this is not for everyone and for every patient, but if they're able to, this will help them to engage with us on a better level. There's going to be shorter appointments with patients who use this service. I do notice with e-consults and other digital tools that have been given to us, I noticed that the consultations, are better. You already know going in, you've read questions, you know what the answers they've given, and you can build upon. It saves time, and it sounds, for the patient, it makes more sense because they're also on the same page. You get more time to spend with other patients who might not have digital access. So it removes the unnecessary queue on the phones. And it links in, these tools will be able to put in the codes into your system. So it will make reporting a lot easier. And especially now we're moving towards automated data collections. The gathering QoF, there's Liz data, which often do help our practices, with financial incentives to, it just helps to employ more people or provide better care. And I think the importance of this is to build resilience into the system, because just now the second wave is coming to an end, but there might be other waves and we don't know how long this is going to carry on. We could be in this, for a couple of years. So it's to help us build that resilience, and QoF is back on the scene. So this is what I'm hoping that this product is going to help us with. These are the benefits. Can I have the next slide, please? So today we're mainly talking about One Contact and a few other tools that we're going to use to monitor a couple of things. So this table is comparing Accurx, Accurx Plus, and One Contact. These things are available to us, and it just helps you see. And don't worry about the slide. We will share it with you later. You can see that the text messages, which service is available in One Contact and which is not. I think the plus point for me with One Contact is it has data reports that can be sent back to the CCG. Because I know with my manager, like weekly data reporting is really difficult, but we still do it because we're using the products, and if we want to improve the services, we do have to let them know. Then you do need to have those figures. But so for me, this is a big point that, it will take out the pain of reporting. And yeah, so can I have the next slide, please? So at this point, I just want to remind you that you can put questions in the chat and we'll answer them as we go along. Or if we can't, we will get back to you. We'll email, the recording. And also, there is CPD available for this webinar. So if you want to claim that, if you just fill out our feedback form for us, you'll get the CPD. So I'm going to hand over to Dr. Dustin Saint, who's a GP, and he's going to talk to us about One Contact Digital Solutions. Over to you, Justin.
Brilliant. Thanks ever so much, Esma. Can everybody see my screen okay? I'll take that as a yes, unless somebody shouts at me and says no.
Yes,
So,
Justin, yes.
Brilliant, thank you very much. So thanks everybody for inviting me this evening to your talk. I'm going to talk to you about One Contact. One Contact is my baby, really. I'm a GP based in rural Norfolk, and I set up a company called Primary Care IT about 4 years ago, really just to share a lot of the IT tools that we'd been using within my own practice. I'm one of those kind of geeky chaps who just tries to build things to make life easier for his own practice, for his own patients. And we started sharing a lot of those tools with other practices, and then it got to a stage where we thought, you know what, we actually need to do this formally, with proper rules and regulations, and tick all the boxes that you need to do from a clinical governance point of view. And we've primarily built tools within EMIS Web, but then have also built tools within System 1 and now also tools sitting outside of the system. And One Contact is the first of our tools that sit outside the system. We developed this in collaboration with a company called IATRO, who provide us with the tech kind of front end. And they, like us, are really focused on trying to just drive better quality care for patients and easier lives for GPs. So it's around about the time that COVID hit that we immediately thought, hang on a minute, we really need to be able to do the kind of quality of reviews that we normally do in practice for long-term conditions, but we need to be able to do that remotely. And at the time, I scoped all of the different products on the market and thought none of them quite deliver the kind of holistic review that my patients would get if they were to come and see our practice nurse. And so that was where the idea for One Contact was born, really, where we thought if we could take a high quality review that was done in practice, and if we could try and shift as much of that to being remote as possible for those patients who can access remote tools, then that would free up our nursing team to be able to deal with those patients who couldn't have their care delivered in that way. And that's where it came from. So today, what I'm going to talk to you about is just how to get started with One Contact. I'm going to give you a bit of an overview of the tools, a bit of a guide to the process and how it works, and then give you a bit of a view of what the tools and reviews look like. The most important thing really is getting started with One Contact, because if you get logged into it, get onboarded with it, then you can have a play, you can send the reviews to yourself, and you can text message yourself with some of the reviews, and then you can have a look at them and see what you think and see if they fit in with your way of working. Equally, we're really keen to get feedback. So if you look at them and you think, do you know what, they don't fit with our way of working, let our team know about it. The whole point of this is that it's supposed to work for you and for your patients. And if there are things that we can do to make it better, then please let us know about it. You'll notice on the Getting Started page, there's a very prominent give us feedback page. And importantly, we also get feedback from every patient that completes the reviews to let us know how they found the reviews, and we're continually iterating and building the tools. The other thing about the One Contact platform is we really want it to be owned by local areas, and if your PCN has got particular projects that you want to do, and that involves data collection, and you want us to build tools for you to be able to do that within your PCN, we can happily do that. So you can literally build your own tools within the platform to suit your local requirements. So talk to us, let us know what you need, and we can try and help. So this is onecontact.health, which is the web address that you need to go to. And I've put the guide to getting set up in the chat. So if you click on that link, that'll take you to the getting started guide. So you can see on this page, you've got, if you're already registered, you can log in with your username and password. If you're new, then you can click on sign up and get signed up. And if you want to watch the onboarding video, you can watch that there. You can see you can request forms, you can make suggestions, or you can contact our support team for help. And if you just want a bit more of an idea of a demo, then you can watch a demo that we did with Gandhi from EGP Learning. So this is the 4-stage setup process. You just pop in your surgery name, put in your organizational code. So that's usually, I think in your area, that's going to be an F followed by 5 numbers, and then click on the next step. You need to put in an email address for the administrator of the forms platform. So this is the email that if there are unattended to responses, that this will go. So it's quite important that whichever email address you put in here, you can change it afterwards, but this one should be an email address that gets looked at on a regular basis and is monitored. Then choose which clinical system you're using and click next step, and then choose yourself a username, pop in your email address, pop in your password, and then confirm your password and agree with the terms of service and click a create account. And that's as simple as it is to use the OneContact platform. So I'm just going to nip forward a little bit. Once you've done that, you'll log into our home page, and that's what our home page looks like. And you can see down the bottom here, you've got some forms that you can select and that you can send out. So this is the process. You can identify that the patient needs a review. You can use our web interface to generate a review code, which can be sent out to the patient. You can either send that out using our platform, or you can send it out using AccuRx or iPlato or any other text messaging platform that you might be using, or even via email if you want to. You can just copy and paste it from our platform. The patient then receives the text with or the email with the link to the review. The patient completes the review remotely, and then the review comes back into our platform, and the clinician can decide what they want to import into the clinical system. So that's the process. That's the platform. If you click on one of those reviews, so if I was to click on Learning Disability Annual Health Check, it would take you to this page, and you can copy and paste that link into AccuRx or into any of the other text messaging systems. Or if you've set up gov.uk Notify with our platform, then you can click Send Now. Setting up gov.uk Notify does take quite a bit longer. It's about a 30-minute process to register with gov.uk Notify and then link that with our platform. The link in the chat gives you the full instructions with a screen-by-screen description of how you do that. It does give you 25,000 free text messages a year, and it means that it links straight into our platform and allows you to send the text messages in that way. So it probably is worth spending half an hour to do that, so that you can just send the messages directly from within our platform. Once you click on send out the invite, you can then put in the phone number of the patient. If you've done a search within your clinical system and you've identified multiple patients who need particular reviews, then you can drop those mobile phone numbers in here. We have got, and we're going to be doing a future webinar which goes into a bit more detail about a recall system that we've got, which involves a whole series of searches that you can use to identify your patients, and our platform automatically can send out the appropriate review to the appropriate patient when you upload that information into the platform. But we won't go into that detail today. So you just drop in the mobile phone numbers that you need there. You can amend the invite if you want to and put in any detail that you particularly want to, and then click Send Invite, and then that invite goes out to the patients. The patient then gets the review that you've sent out, and then when you click on responses within the platform, you can see these responses that have come back to you. The really good thing about the responses within OneContact are that they've got, they literally show you what you need to know about the patient at the top. So you can see on that video that we've just watched, at the top it pulls out items that need attention. So this person's got a poor self-rating of asthma control, and then it goes through and shows me all of the rest of the information that I need about that particular patient's asthma review. And then we can pull that information back into the EMIS system. So we're going to talk about pulse oximetry at home now. So I'm just going to drag over a video to show you about that. So when you're doing your oxygen sats monitoring, we've got within the One Contact platform a COVID checkup form, and this allows patients to submit either a full assessment or just their oxygen saturation monitoring. And you can see this is the patient view of the monitoring. So we've embedded videos within there about recovering from COVID, and you can see it asks all sorts of different questions about how they're feeling with their COVID and what their symptoms are like. So what other areas have found is really, really helpful with this is that when they get this information back, it actually gives them a way of looking at the information before they phone the patient, and then they can hone in on the particular area that the patient's struggling with, or if actually all of the areas are absolutely fine, then they can just catch up with the patient and just go through any of the information, and it can speed up the consultation quite significantly. So you can see it checks out how your support network is, how you're getting on with food or other supplies. You've got other videos linked in there as well, screens for mental health problems as well, and all sorts of different bits and pieces in there. So hopefully that gives you a bit of an idea. You can see it's really nicely laid out, all in kind of NHS logos and NHS branding, so it looks familiar and looks the same as the NHS Choices website if you look at the styling of it. And you can put in your oxygen saturations monitoring there. So we'll swap back over to the presentation. And so this is moving on to your local pulse oximetry requirements. So, so these are for delivery in primary care. You've got a localized standard operating procedure to drive delivery, and the pulse oximetry at home should be targeted at patients who are either diagnosed with COVID-19, either clinically or positive test. They've got to be symptomatic, they've got to be age 65 or older, or under 65 and clinically extremely vulnerable to COVID. So those are the patients that are on your CEV list, and that's on the JCVI guidance. So your national support offer, including oximetry supplies, targeted at that defined national cohort. So those are the patients that you should be targeting for oximetry at home, and those are the ones that you can send the requests out for from the One Contact platform if you want to. So what's the referral process? So we receive or make referrals, triage patients with a standardized assessment, onboard and supply the oximeter, monitoring by checking in with the patients. With One Contact, that could just be that you ask the patient to submit the monitoring on a daily basis back to the practice, and then when they've recovered, you can discharge them from the service, recollect the oximeter, and then safe reuse of the oximeter. So you should have had received a delivery of pulse oximeters from the CCG or through your GP federation, and if you haven't or you require more, then please contact your federation. There are some great resources online that can support you with this, and there are some YouTube videos, and we'll pop the link to that in the chat afterwards. You can access guidance in other languages, and that's at the back of the slide deck. The clinical effectiveness group with ourselves have developed a template that will support you to manage your patients, including linking them to the correct SNOMED codes. So if you use the KEG template, at the bottom page has got the oximetry monitoring page on it, and the codes in there are the correct SNOMED codes to record oximetry. And for support, please title your email oximetry@home query and send that to this email address, and you can get some help with that. So oximetry at home is available through GPs in Barking, Dagenham, Havering and Redbridge from 8 till 6:30 Monday to Friday. In Redbridge, the local federation, Heathbridge Direct, from 8 till 8 Monday to Sunday, also offer the service. Out of hours is provided by 111, and as we said, the inclusion criteria: 65 or years old or over, or under 65 with clinically extremely vulnerability status, and oxygen saturations are greater than 93%. So for 111, just note that patients who contact 111 in the out of hours period may be booked into a next day slot at the registered GP in hours to be followed up should the clinician feel that this is safe to do so, and the 93% may be lower for patients with an existing lung condition. So this is looking at the reporting options for pulse oximetry at home. I'm sure your practice managers have probably been talking to you about the volume of data requests that are coming through for this. So we thought this was quite a useful summary of how the reporting options can be. So when you're issuing a pulse oximeter or BP monitor for at-home usage, you need to discuss and agree how to return the readings with the patient. Ideally do the first one in the surgery, and then your options for doing it at home are either written, telephone call, AccuRx Plus, or one contact. If you're using written, then if you should be using that if patients are unable to offer telephone or preference or language restriction. You don't really need any prompt of the patient, but it's going to be manual at your practice, and it's quite labour intensive. The fallback option could be supported by the carer, so that would be an option if you've got a patient who's got a carer and they want to report back in a written way. If you're using telephone, they've got to have a landline or a mobile telephone. You're going to need to prompt the patient yourselves within practice. It's a manual process which you've got to transfer to the GP system, but it does allow a two-way real-time communication exchange to check up on the patient and see how they're getting on. With AccuRx Plus, you need a smartphone or an older brick phone, a PC or a laptop, and then the prompt to the patient can be a diarised text, and that can automatically feed into the GP system to accept, and it's fully automatic. If you're using one contact, again, you can use any type of mobile platform with that, so either smartphone, web, or PC, laptop, or any other mobile device. The prompt for that can be a diarised text, and it can transcribe back to the GP system. It's useful for larger data capture, so you can see the video that I showed you of the COVID review collected lots of data about a variety of different things, allowing you as a clinician to focus in on the things that are wrong with the patient quicker. And also the other advantage of our platform is that we can, subject to the proper data sharing agreements with your practices, we can report back to CCGs and to NHS England and Digital about the usage of oximetry at home. So it can save your practice managers quite a lot of time in terms of the reporting that's required. And that's me. So I'm going to pass back over to Shabana now and stop sharing my screen. But thanks for listening to this.
Hello, everyone. I'm Shabana Ali. I'm a GP and a clinical director for cardiology across BHR. Thank you, Dustin, for your presentation. So if I can have my slides up, please.
Bear with me, please. I'm just getting it up.
So I'm going to talk about blood pressure at home and give you an overview of what it entails. Next slide. So in January 21, BHR CCGs were successful in getting 490 blood pressure monitors for remote monitoring of their highest risk hypertensive patients. And we decided to distribute them to practices, although we didn't have the ideal pathway to hand. But we thought that with the existing guidance, as with any project, there is a warming up period, and practices where clinicians are seated know what they do, and hence they'd be able to start the pilot as we work through the final high grade detail. So with, of course, the blood pressure monitors comes the reporting required by NHS England, and the SNOMED codes was given by NHS England, which I will talk about in detail a bit later, were in development. But one contact is able to help with reporting immediately. And we are told that if BP at home is a successful project, there are more blood pressure machines in the line to be distributed to practices. Next slide. So the risk stratification and allocation of monitors was based on these priorities, and this came from NHS England. So you had your group 1 patients that were on your shielding lists, and with the blood pressures above 150/90. And then you had your group 2 patients that had a history of TIAs or stroke and having uncontrolled blood pressure. In this, we asked practices to prioritize their diabetes patients because a condition that has a tenfold, a more than a 4 to 5 fold increase of an event should be prioritized. So we asked practices, although this didn't come exactly the ask from NHS England, but we thought it would be a good thing to do. Group 3 patients, you've got the advice there. They were encouraged by their own blood pressures. And of course, in the pandemic, we all have experienced that GPs and have come to face with patients having bought their own blood pressure machines, thermometers and pulse oximeters in order to give the readings to clinicians. So this wasn't the concept new. Just to reiterate, we did have some Omron 7 M7 blood pressure monitors that actually pick up AF. They were very far and few, but they were distributed as well. Next slide, please. In February, we had some further clear guidance in the form from UCLP Proactive Care Framework. And it came with a lot of long-term conditions, and in specific, the hypertension one. So we again distributed comms to practices to follow this guidance. Next slide, please. I'm not going to talk through this busy slide, but just to highlight and take note that the beauty of this guidance was that you had your priority to set. We are in a pandemic, in lockdown. How do you prioritize your patients? And I think the guidance is very good in which it tells you your priority 1, probably GPs, 2 and 3, how to manage them, how to risk assess them and do further management. It goes also into the nitty-gritty detail and guidance to healthcare practitioners, your HCAs, in how to take the blood pressure and also what other resources they can use. Next slide, please. Then again, this is all part of the guidance, and I'm sure if you haven't had sight of this before, once you, after the webinar, you will go back and revisit these. And it's quite interesting where they give us a comparison between your clinic blood pressures as well as your home blood pressure readings. Next slide, please. So at present, I just wanted to talk a little about a bit about the SNOMED codes. So when the blood pressure machines were distributed, this was the guidance given because this is what the ask was from NHS England. But of course, they had a problem with these codes. It didn't tell you whether it was captured at 1 day, 4 days, or 7 days, or whether that was an actual good control of a patient's blood pressure. It didn't also give the idea whether it was taken in clinic or at home, and whether it was just a one-off reading being coded as an average day reading. Next slide. So, so since then, since the distribution, we've had further sort of updates on the read codes, and it's decided that you need a combination of codes to get the reading across. So you would have your average readings, as well as combination code, which tells you where this reading has taken place. Next slide, please. So these are the codes that we are, through this webinar, distributing now and making you aware of, and further information as we come along for the rest of the codes we will distribute. But it gives you an idea that the average home systolic blood pressure, the average home diastolic blood pressure, and also it's recorded at home. And I'll talk about, just referencing to what Dustin said, that when you do have the one contact data back, you immediately know through the color coding that which patients need your attention more. Next slide. So along with this comes patient resources and of course, reference to clinical support. So patient information is there, and we've been quite savvy in terms of using this through our AccuRx platform in which we can cut and paste the advice and guidance and then distribute it to the patient. And also for clinicians. Next slide. And these are just details of patient resources. I'm sure you'll have a read of these and have access to these. Next slide. And this is further detail on home monitoring diaries, as well as validated blood pressure monitors that you can share with patients and carers. Next slide. So what do practices need to do now? So first of all, run your searches. You've got your own searches, but we are awaiting update searches from KEG based on the risk stratification that we have talked about earlier. You prioritize and distribute monitors. I was of the opinion that patients, all practices have intelligence. They know they're poorly controlled hypertensives and they would prioritize them automatically, and especially if they had diabetes. The second thing is that the platforms that are there to use is OneContact and AccuRx Plus. OneContact takes the headache out that, and especially practice managers are in the group are going to love this, because it takes the reporting intense work away from them. So what I would ask for practices to do now is that establish your workflow in practices using the risk stratification tools. Start using the remote monitoring tools that we've introduced you, whether it's AccuRx Plus or OneContact, and see what suits you. But once you establish the workflows, you would know immediately as the data comes in, especially with OneContact. The beauty is that you can delegate. You can delegate to your healthcare professional, your practice nurse, your pharmacist, or the more important ones to the GP. Thank you. I'll hand it over back to Uzma now. And I hope I didn't take much more time, Uzma.
No, thank you. It's brilliant having all that information and, you know, summarizing what benefits we have. So I'll move on to the next speaker. Is Dr. Anju Gupta is going to talk about remote monitoring with long-term conditions. Thank you. Over to you, Anju.
Thanks, Uzma. So I'm Dr. Gupta. I'm a GP. I'm a diabetes clinical lead, and I'm a DUK clinical champion for diabetes. Next slide, please. So you've heard how remote monitoring will help with pulse oximetry, with blood pressure. I want to talk a little bit about how it can help our long-term condition patients. So over the last year, and I'm sure you'll all agree, the one group of patients that have been affected most, their care has been withheld almost, is our long-term condition patients. A lot of whom have not had their usual annual care, which we would provide, we would provide to them. So I think remote monitoring and platforms like the ones we've discussed with you today, OneContact and AccuRx couldn't have come at a better time. So as we face a huge backlog of patients, what can we do to expedite care, to triage patients and make sure we are seeing the highest risk ones first, and also, as Uzma alluded to, build resilience within our system, because we do not know what is really in store for us for the next 12 months. So forever more now than in past, patients of long-term conditions are becoming our partners. In the last year, we have depended more and more on patients to check their own blood pressure, to check their own oxygen, temperature, and so on. So we need to build on that relation using these platforms. So I've been able to use some of these pre-questionnaires for long-term conditions in the last few days and test them out. So what we can do now with these is we can send a pre-questionnaire to patients, for example, for diabetes, and the patient will fill that in their own time, in the benefit of their own surroundings, with as much space and time they want to devote to this, and they send the questionnaires back to us. What that does for impending consultation is that it sets the agenda and it brings out what is most important to the patient for their long-term condition. Say, for example, diabetes. Now, since some items have been dropped from cough in the last few years, for example, depression or sexual dysfunction, we do tend to forget sometimes to ask those. And diabetes being such a biopsychosocial issue, if we haven't addressed a person's diabetes, or if we haven't really addressed what is important to them at that time, then we can't really move forward with improving their control. So by choosing this as a pre-questionnaire and sending this out, for the patients who will actually engage with this, we really can set the agenda for a consultation. We can also triage. So for example, you've seen, I'm still on the same slide, if that's okay, thank you. I promise I'll cut out some of the slides. I'm very wary of the time here. But just wanted to mention, so it also helps us triage our patients. So well-controlled asthmatics, for example, could then be contacted by a pharmacy technician or the pharmacist. And increasingly, we will have these colleagues in our wider primary care team as we start recruiting the full cohort of our ARRS. So what that means is GPs or ANPs will not have to see everyone, and the patient will get the right care from the right person in the team. It will provide a framework and resilience, as I've always said. And again, we're very, very lucky in our patch to have 2 options so far, and both of them entirely free to use for the primary care team. Next slide, please. So what do we need to do to start remote monitoring? And again, a lot of this has been already discussed, so I will just whiz through it. So for GPs, as everyone has said, maybe we task our link worker for this, or maybe we task our pharmacy technician, or whoever you consider the most suitable person in the team. They send out these questionnaires, especially asthma, very simple questionnaires just to send out to the patient, and you will receive them back and you triage and then appropriately distribute to relevant clinicians. Patients, they can answer, as I said, in the safety and the comfort of their own houses. Next slide, please. So just wanted to give you, share a couple of examples of how we have already piloted in BHR some of these remote monitoring tools. So last year, just as the pandemic was coming in February, March time, we had the opportunity to pilot a remote near patient contact urine ACR kit. So a kit was sent out to patients in the post. The patients were able to test their urine for protein or albumin in their own homes, and via an app, the results were pinged back to the GP system. So 3 or 4 B&B practices took part in this pilot. 811 patients were found to be eligible, 507 consented, 374 performed the test, and 91 people were actually found to have significant albuminuria. So you can see, as an example, this happened just around the pandemic time, and people in March, I remember a few people who were shielding, couldn't leave their homes. It was so timely, an intervention at the time, and going forward, we are hoping to roll this out for our diabetes patients across NEL. FibriCheck was another project that Dr. Ali led on. Again, during the pandemic, it's a remote monitoring tool to detect arrhythmias and atrial fibrillation. 174 patients took part in this pilot, and 37 patients actually were detected to have arrhythmia and atrial fibrillation. So again, a very useful pilot. Next slide, please. So again, just quickly whizzing through last couple of slides. I know I'm out of time. Accurix Flories will be available from 1st of April. We don't have to do anything. They will just come into our system. I have used a few really very, very useful asthma, depression, anxiety, pill checks, everything can be done remotely and very helpful going forward. Next slide, please. Yes, it will be automatically uploaded, as I said. Next slide, please. And One Contact, you've heard a lot about it already. It gives us additional disease review packs, including learning disability. Usually takes a lot of time, and where you use this, the carer can do this at home, preventing a person with learning disability having to spend a lot of time in the practice where they get upset or agitated. Next slide, please. And we've already heard how to log on to One Contact, so I will miss that one. And I think I'm done. Thank you very much. Handing it back to Uzma to conclude.
Thank you, Anju. Thank you, everybody. I know it's very late in the evening, and thank you so much for being a lovely audience. And a big thank you to Dustin, Shabana, and Anju for doing the talk. As you can see now, at the end of this session, you have now, the benefits of remote monitoring, how to access One Contact, how to sign in and on board to the One Contact, how to send out the first patient reviews, and how to give feedback to One Contact and our team so that we can develop it further. If you have any ideas, like Louise said, of how we can help you or improve, if you have any suggestions, please do email Louise or Richard Clements about this, and you can directly email or send contact, messaging to the One Contact team. And also, it was touched on this, so you're aware that there is automated data submission in this process that will help your managers and will help the CCG and the commissioners to improve upon the tools that have been provided. We need that feedback so that we can help you and get the necessary tools that we need, especially in this day and age. Now we're in a pandemic and we're moving on, and we need to, QOF is back on the scene. So there's a lot of things that these questionnaires are going to really, really help and take the pressure off the clinicians, and also to do those face-to-face contacts. With this, if there's any questions, people can mention them now and use the chat facility. We've got Dustin here, Shabana and Anju, your experts for these different areas. Apart from that, Louise, do we have any other questions, or Richard? We've got Mark Lockwood here as well, one of the commissioners from the IT area in the CCG in primary care. So if you've got any questions, this is your time. And I just wanted to, can we have that slide up which has the next webinar dates? Because we do have a few other webinars planned in, like the one next week we have in pediatrics, and there will be more webinars on remote monitoring. We will put it on our intranet, so you can have a look on them when you visit it regularly, and you can sign up to join these webinars. And then they will be shared across in an email, so you can share it with your other colleagues at the surgery who might not have been able to join us today, or the other webinars. And do let us know if you have any suggestions of what else you would like us to bring to you, anything in particular. Like we have some more webinars planned, like for dermatology and the non-clinical pathways, because they're also very important issues in the non-clinical pathways. So with especially with the long COVID, we've had a choir service that has helped patients with long COVID. There's a lot of, with the DWP, the local authorities, the social prescriber, third sectors, we're working with the non-clinical stakeholders to provide these patients with the support. And the information is on the intranet. So if you want to access these services or know what else is out there for your patients, please do visit that. If you have questions about these non-clinical pathways or services available, do email Louise Brent at the CCG, and she'll be able to put put you in touch with all of with the necessary teams. Does anybody have any questions? I'm just looking at the chat and I can't see any particular questions. Louise, do you want to mention, or Richard, anything? That
just really to say,
So this slide has all the emails on it, and we will share the slide, so you will have all the emails that you can actually email for more. And I'd like to remind everybody at this point, if you want the CPD point, you can get it. Please, we just need your feedback for this webinar and how to improve it.
Yeah, so I just wanted to say that we're moving into a new area, and some of this is going to be new to us, and there'll be teething problems as we go along, but we want to work with you all on anything. So anything as you start moving into using remote monitoring and especially the digital tools, please keep talking to us, because then we can make sure that we're designing the best tools for BHR possible and for our patients.
Thank you, Louise. I think with this, we've concluded our webinar today, and it has, I'd like to thank Dustin, Shabana, and Andrew, Louise, and Richard for organizing this, and for everybody for being such a fabulous audience. And just let us know if there's any feedback, anything you'd like us to change. And thank you very much. Have a good evening. Thank you.
Thanks, everybody. Much appreciated.
Thank you, Dustin. Thank you, Shabana.
Thanks, Isma.
Thank you, everyone. Thank you.
Thanks, everybody.
Thank you, Richard. Thank you, Louise.